Hi everyone, Dr. Benton here. I just wanted to provide a quick overview of Chapter 17 that covers the anatomy of the cardiovascular system. The cardiovascular system is also known as the circulatory system. It consists of the heart and the blood vessels. A little more about the heart and its location is listed here. So it's in the middle of the chest pretty much, but it's shifted over to the left side just a little bit. And that's, of course, superior to the diaphragm and posterior to the sternum. The heart is covered by the pericardium, and pericardium is the outer sac that encloses the heart. The fibrous part of the pericardium is the most outside of the covering, and then the inside is called the serous, and it has two layers, the parietal layer and the visceral layer. A visceral layer is also known as the epicardium, and it directly covers the surface of the heart. Then the space between the two layers, called the pericardial space, contains a fluid called pericardial fluid. And this drawing gives you an idea of the locations of the fibrous versus the parietal layer and the visceral layer of the pericardium, and then it shows the space there. The wall of the heart has three layers: the epicardium, the myocardium, and the endocardium. So the epicardium we've mentioned, the myocardium, myo means muscle, that's the thick muscle layer, the middle layer of the heart, and then the endocardium is the most inside layer of the heart. And then when we get to the anatomy of the heart, we start talking about the chambers, and there are four chambers: atria and ventricles. The atria are on top. See them there in the drawing. There's the left atrium there. The right atrium is shown here. The ventricles are the chambers that are at the bottom. And let's draw this out. I think it's useful to kind of take a more simplistic approach as you're first learning this. So the way I like to explain this is by drawing it as a box. Now I know the heart is not shaped like a box, but this gives us an idea of how to learn the various structures. So the atria are on top, the ventricles are on the bottom, and then the first thing you'll want to notice is that the right is here, the right side, and the left is here. Why is that the case? One is because of the anatomical position. You're looking at the person face to face. And if you're facing someone, your right is their left and their left is your right. So that's the first place you want to start. So if we want to trace the path of blood through the heart just with my kind of crude diagram here, we would start with the blood coming into the heart, and this vessel is called the vena cava. And we'll look at these, see these on the slide, and it'll be in your textbook as well. And there's a superior and inferior vena cava that brings the old used up blood in the heart to the heart. So our first stop is the right atria, and then the blood goes then to the right ventricle. And between the atria and the ventricle, there's a structure called a valve, and the valves keep the blood from going the wrong way. So there's a valve there, and a valve there, and a valve there. So four valves, and the valve on this side is called the tricuspid valve. We'll see it again, the word, in a few moments on a slide. Tri means three, like a tricycle has three wheels, and that refers to the three flaps of the tricuspid valve. And then once we go to the right ventricle is going to send it to a vessel called the pulmonary artery. Call it PA for short. And by the way, this valve is just called the pulmonic or pulmonary valve, just named after where it goes. So the pulmonary artery, and then the pulmonary artery is going to, I'm just going to draw it up here, take it to the lungs. Now we know that the lungs are on both sides of the heart, but just to humor me for my drawing here. And then the blood, of course, receives oxygen there. And now we've got blood that's going back to the left atrium, and this is called the pulmonary vein. Okay? So we have the pulmonary artery taking the blood to the lungs, pulmonary vein taking it back to the left side of the heart, and then the left atria sends the blood where? Down to the left ventricle. So that would be our step 3, I guess, and our step 4. In between the left atria and left ventricle is another valve This one has two names. Sometimes it's called the bicuspid valve because it has two flaps, but it's most commonly called the mitral valve, M-I-T-R-A-L. That's two names. Okay. And then the left ventricle sends the blood to the aorta, which sends the blood to the rest of the body. And that's the major artery that leaves the heart. And then this valve here is called the aortic valve. So that's kind of a simplistic way of drawing through it. If you're a visual person, that might help you. If you like the words, stick with the words, and that's fine. So let's go back to the drawing, to the slides now. So we talked about the atria, and the atria are the top, of course. Here's what the heart really looks like. So remember, I drew the atria on top. See, they're still there. The ventricles are on the bottom, just like my drawing. But where it gets kind of complicated is, remember I had the pulmonary artery coming off the bottom of the heart? It doesn't really do that. It actually comes around the front and over the top. Okay? But I can't draw in 3D. And the same thing with the aorta. I had it coming off here. It actually comes off here. See it coming off the top there? So, but I think that once you learn the basics through a drawing like mine, you can kind of apply these pictures and make more sense. So hope that was helpful to some degree. And then so again, the ventricles are listed here. This talks about the valves that we mentioned, the tricuspid and the bicuspid valve, also known as mitral valve. See it listed there? And you probably noticed that it calls these AV valves, atrioventricular valve. That's another name for the tricuspid and the bicuspid or mitral. Because where were they located? Remember in our drawing? The atria are up here, the ventricles are here, the atria are up here, ventricles here. Where were those valves? Those valves were located here, right? Between the atria and the ventricles. That's why they're called AV valves. Also known as AV valves. And here's a drawing of the heart as it's going through the contraction. And what happens as the heart beats is first the atria contract, then the ventricles contract. So if you listen to a heartbeat, you hear two sounds, right? Lub-dub, lub-dub. And that's because there's two actions. First the atria contract, see them they look kind of shaky here. And then when they relax, the ventricles contract. Okay? The words are systole and diastole. So systole means work, diastole means rest. So first the atria contract while the ventricles rest, and then the ventricles contract while the atria rest. You can also see the valves opening and closing here. If you look very closely, you can see the tricuspid has 3 flaps here, and the mitral has 2 flaps. Oh, there they are closed, and you can see it even better. See that? 1, 2, 3 versus 2. And the valves at the bottom of the heart in my drawing, but actually the valves that leave the ventricles are sometimes called semilunar valves. So remember, the valves that were between the atria and the ventricles were called AV valves. The valves that were between the that are there as the blood exits the heart, the pulmonic and aortic valves, they're sometimes called semilunar valves. That means half moon. That's kind of referring to their shape. And you can see the names of these here at the bottom of the slide. See pulmonary valve and aortic valve. So this goes through the blood flow of the heart. This is what I tried to show you in my basic drawing. So if you want to see it in word form, there's a great place to look. And it just goes through the same steps we went through. Right atrium through the tricuspid valve to the right ventricle to the pulmonary artery to the lungs to the pulmonary vein, to the left atrium to the left ventricle, and then the left ventricle to the aorta. Okay. Coronary arteries coronary arteries and veins are the vessels that feed the heart itself. So you've probably heard of someone with heart disease having a coronary artery disease. And that's referring to the vessels that feed the heart itself. For example, the coronary arteries come right off the aorta, and they go around to the heart, and they feed the heart. Coronary veins go back, send the blood back to the right side of the heart. Okay. And there they are. Okay. What about the nerve supply to the heart? Well, there are some nodes that we talked about in the discussion board that help activate the heart. It's kind of the electrical supply to the heart. We look at that more in the next chapter. And then arteries. Arteries always carry blood away from the heart. A for away. And we start with the aorta, and then we get to the other kinds of arteries. The smallest type of artery is arterial. So we have aorta, then artery, then small arteries are called arterioles. And then we go into capillaries. And then we get to veins. Small veins are called venules. And then we have veins, and then we have the largest vein, the vena cava. And this is talking about the structure of the vessels. There's differences between, for example, arteries have veins have valves and arteries don't. The layers are listed here. 3 different layers: externa, media, and intima. They all have those 3 layers, but in the case of arteries, the media, the middle layer, is thicker, and that's to withhold the pressure of the blood flowing through the body. Several different kinds of circulation are mentioned here. Systemic is the blood flow from the heart to all the rest of the body. Pulmonary is just getting to the lungs and back to the heart. And then portal system is blood that flows through 2 different capillary beds instead of 1 capillary bed. More information about the major blood vessels are listed here, and then the book just goes through and gives you the opportunity to see and to label if you'd like to, or color, or however you want to study this. I think anatomy coloring books are a great way to study and learn these major arteries and veins. This also talks about fetal circulation, because there's something that's very different about the fetal circulation, and that is because the lungs are not used in fetal circulation. I'll just have to draw this out here to explain it. So remember our heart. Here was our adult heart here, okay, and we went from 1 to 2 to 3 to 4, okay, but in fetal circulation, in a fetus, we're not using the lungs, right? So we go from 1 to, we're gonna skip here the right ventricle and go straight to, from the right atrium to the left atrium, and then down to the left ventricle for circulation. How does it get from there to there? Well, there's a hole in the heart. While you're inside your mother, there's a hole right here, and that allows the blood to flow that way. So you've probably heard of a baby having a hole in the heart. Well, we all have that when we're inside the mother, but that should close after childbirth. And that's called the foramen ovale. And this is more detailed about that. It says the foramen ovale becomes functionally closed after birth. Yeah. And there are other parts about the circulation of the liver and how the placenta is involved. Okay. So I hope this was helpful to get you started in Chapter 17, and look forward to any questions that you have. Thanks.